There is a post spreading online that is getting a lot of attention. It portrays how easily someone can get COVID-19, then spread it with the person from person to person, and that person not having a single symptom. Someone asked the Verify team to fact check this. Here's investigative reporter Cheryl Mercedes.
The illustration shows a little girl named Sally who was exposed to COVID-19. Tested negative 5 days later, then, thinking she was in the clear, went to school and a family cookout. 2 days later, she started having symptoms and tested positive, potentially exposing 17 people she came in contact with just 48 hours earlier. The timeline has been recreated using different characters and has been shared on Facebook hundreds of times. RP asked us to verify, is this true? Our source for this is Dr. Michael Chang, assistant professor and specialist in pediatric infectious diseases at UT Health McGovern.
I think the way it's displayed is a little bit alarmist, but at the same time, it is accurate.
Dr. Chang says while true, the picture lacks some context.
Can this happen? Yes, but it's not very common. And so I don't want people to think like, oh, this is happening all the time, where people are getting negative tests and then becoming positive afterwards.
Dr. Chang says there is a such thing as getting tested too soon. The CDC explains a negative test result could mean the virus was not present when the specimen was collected, but it does not rule out COVID-19.
That's why the CDC recommends that if you do want to get tested, if you can wait to day 5 or 7, to get tested, that should improve the performance of the test.
I spoke with Houston Health Authority Dr. David Pearce. He tells me that a negative test result when no symptoms are present is not reliable. It is a message he says he's been struggling to get people to understand. If you have been exposed to someone with COVID-19, you should quarantine for 14 days. With your Verify, I'm Cheryl Mercedes.
If you see something you are not sure about, let us know on our KHOU 11 Facebook page or Twitter. Also email us at verify@khou.com.